So Julian and Darren, congratulations, first of all, on winning the Life and Health part of the Global Innovation Awards. I thought that was a packed field, and I'm delighted for you guys that you rose to the top. I thought maybe I'd start just by asking you to describe a little bit about, from the Hannover standpoint and from the Health Home, soon-to-be Kadance standpoint, what it is you guys are doing.
You want to go ahead?
Sure. So Kadance, Health Home. So Health Home is our current name. We're transitioning to Kadance. So Kadance is a precision health management company. We've developed a platform and a program that helps policyholders understand and manage their risk of certain diseases. Right now, we're very much focused on cancer, but over time, that will evolve into cardiovascular disease, neurodegenerative disease, and so on. And our program has three components. It's really based around sort of prevent and manage, and then manage a disease. If you are diagnosed with a disease, as I said, cancer is the focus right now, and then also recovery sort of component. And we've been working with Hannover almost from day one. Hannover partnered with us and invested in us very early on because I think, like us, they realized that there was great alignment with the life insurance industry, who are obviously very keen to think about ways of engaging with policyholders in a more meaningful way, but also ultimately trying to impact the mortality curves and help people live longer and healthier lives. So that's essentially where we are. So
yeah, and for us, Paul, we're delighted to be here and to be partnering with Health Home. The inspiration for a lot of our partnership started for us to figure out a way that life insurance could be combined with the genomic science in order to create a healthier population that would live longer and be happier. And so we've been working with Health Home and from day one, and providing the assistance with the pricing for the program, for the benefit design, and funding for the organization during their startup period to help them along.
If you'd walk me through an example, I thought when you made your presentation to the executive committee here at the IAS, the example you had about someone who was diagnosed with cancer, prescribed a drug, prescribed an antidepressant, and so forth, it's compelling. And I wonder if you would walk us through that.
Yeah, I can certainly do that. This was one of the Health Home policyholders that there was a woman earlier this year who was diagnosed with cancer after a lump was discovered in her breast, and she was prescribed tamoxifen, which is a very commonly prescribed drug, to treat breast cancer. It's probably one of 50 drugs that could have been prescribed for her, but the oncologist prescribed that specific drug. In addition, he also prescribed an anti-inflammatory to help her deal with the antidepressant. Yeah, thank you. Antidepressant to help her deal with the anxiety and the stress associated with cancer. But since she was a Health Home policyholder, a PGX test was done for her, and PGX stands for pharmacogenomics, and that's a test that determines how well a person metabolizes a broad spectrum of drugs. And it's an unbelievably helpful test. So that test was administered to this woman. It showed that she was a very poor metabolizer of tamoxifen, and so that meant the drug was totally ineffective, for her. And the clinical findings were consistent with that because she wasn't getting any better. In fact, she was actually getting worse. And then separately there was a negative interaction between the antidepressant and the cancer drug that she was also given that was affecting her adversely. And so in consultation with the oncologist, between Health Home's oncology nurse and the oncologist, the results of the PGX test were shared with the oncologist, and she was immediately taken off the antidepressant. She was given a new cancer drug that she could metabolize, and she responded unbelievably well to that regimen, and she's cancer-free now. And I think a lot of the interventions that Health Home did for this woman probably saved her life, and so it was it was a great story, and it's the same type of interventions that will be done for their entire population that they're of patients that they have today.
So I think this is an incredibly exciting time for healthcare. You have CRISPR, gene editing. I think that's just getting started. I think what Google DeepMind has done with the figuring out how proteins fold and so forth is extraordinary. They published all that sort of information, put it into the public domain, so people can now see how proteins have folded and understand better how drugs might interact with them. Just with that sort of as context, I wonder if you'd tell us a little bit, Darren, about the origin story of Health Home / Kadance. Where did the idea come from?
It's really based on the fact that it takes too long for healthcare innovation to work its way through the health system, through reimbursement, clinical guideline changes and updates and so on. And typically it takes around 15 to 20 years, is what the literature would say. And so we figured that there's this whole group of technologies, resources that are broadly accepted by the clinical community. They've gone through all the relevant testing and trialing and so on, but they're just not part of a routine clinical practice. And there's a lot of reasons why that's the case. And so we figured we could accelerate that. And so we started to look at all these different types of technologies. We talked to patients that had had cancer, and we started to understand more broadly what those challenges were. And I think we can all appreciate that, cancer is a complicated disease. It's very overwhelming for an individual. There's a lot of things to think about. People have to make a lot of choices about things they often know very little about. These are high-pressure decisions. Your life is quite literally on the line. And oncologists don't necessarily have the luxury of spending a lot of time with patients, and so they often feel that they don't have all the relevant information. They don't really know what they have access to. They don't know whether this treatment's right for them specifically or whether it's more of a generalized approach. And we are now in an era of more targeted precision medicine, and so there was an obvious sort of gap there. And so that's really how we started to put Kadance together. We started to look across the whole sort of disease continuum. So, what can we do to help people understand their risk of developing cancer? What can we do in the early sort of days of a cancer diagnosis? How can we raise awareness and educate people? What can we do if somebody is diagnosed with cancer? And there's just a whole, there was just a whole load of sort of areas where we, as an industry or as a health system, we were falling short. And so we started to think about how can we plug these gaps, and in the same, in the recovery sort of survivorship element or stage of the process. And so over time, we were able to put together a very comprehensive plan. We initially, I actually started a very similar company to this in the UK, and we worked with Unum in the early days. And so I'd seen firsthand the impact that these kind of programs could have. And so by combining, the technology with the navigation and the health literacy and the sort of nurse time, the real sort of human, real-time support, it all sort of came together. So that was really the genesis of it. And then as we look more into the future, we can see a very clear path where we're not just helping people with cancer. We can now start thinking about cardiovascular disease, as I said, neurodegenerative disease, as those genomics technologies start to evolve, I think we have a very clear sort of roadmap. And then I guess the final piece was the recognition that the life insurance industry has better alignment with what we're trying to achieve. Economically, it makes sense because life insurance companies want you to live as long as possible. They want to engage with you in a more meaningful way. So the stars aligned really, and that's I guess how we kind of got to this position.
So I agree. I've long thought that there ought to be more alignment between medical insurance and certainly care and life insurance for that very reason, that
Right.
we're all happy the longer somebody lives. In terms of the rollout for where you are now, you talked about other diseases you might get into, but could you just tell us a little bit about where you are now in terms of rolling out the cancer concierge service, and then where you hope to be in 2 or 3 or 5 years?
Sure. So we developed Kadance and Health Home to work specifically with, I'll call it the personal insurance industry. So whether it be life insurance, critical illness, LTC, doesn't really matter. We developed the program to be a rider or a value-added service. So we thought about some of the challenges associated with getting this into the market. We wanted to make it as easy as possible for insurance companies to adopt this type of approach. So that was the sort of the foundation. We recently launched with our first carrier about a year ago with Chubb. We have 2 new carriers that we'll be launching with next year, early part of next year. Over the next 18 months or so, we are expecting to launch beyond cancer. We have a lot of work to do on that, so I'm not going to commit to a specific date, but I think over the next 18 months, we will have a broader set of services that I say go beyond cancer. So that's our main focus right now. We've had interest through Hannover Re from carriers in different countries. We've got conversations with carriers in the UK, Canada, Australia, and one of the panelists earlier on in one of the sessions mentioned that it's very easy to get carried away because there's a lot of interest, but we are really focused on the US right now. We want to continue to deliver high quality services that really impact people's health trajectory. But to answer your question, over the next 2 years, I expect that we will have a broader set of services beyond cancer and probably have started the process of launching some of these services abroad.
Okay. So this is great. Any summary thoughts?
Well, we're excited to be partnering with Health Home. We're excited about the advances in technology, the ability to manage the drug regimen for patients, get them on the right drugs that will help them to avoid hospitalizations, avoid mortality as well. And keep them very healthy. So it's and reduce cost for this. So it's providing the right care, the right treatment, and saving money in the process.
Yeah, I would say that our mission is to create an environment where every health interaction is informed by your unique biological data. Doctors shouldn't be treating patients blindly. They should have access to this information. Patients should have access to this information. We should be managing health in a more proactive way. So that's our vision, that's our mission. I mean, for us, the main focus, as I said, is to continue delivering good service. We're creating an ecosystem, a platform that can deliver these types of services to a policyholder from the comfort of their own home with minimum friction, an integrated ecosystem that can exist alongside and with the current health system. So we're not trying to compete with the health system, we're additive. But our ultimate goal is to make these types of services and these technologies accessible, affordable, understandable, and frictionless That's really what we're focused on, and that combination of the genetics technology, digital technology, and the sort of the human level services combined is really what our focus is for the next, the
I'd say you're off to a
future.
good start. So thanks you guys for the time, and best of luck.
Thank
Thank you very much
Thank
indeed.
you, Paul.